Hello, everyone, and welcome to Surgical Management Professionals webinar on survey readiness. I am Allison Stock, SMP's Chief Operating Officer. Survey readiness is a buzz phrase often tossed around, but what does survey readiness mean? Survey readiness is being prepared for a regulatory and/or accreditation survey, including those unexpected ones. Survey readiness is important because it ensures regulatory and accreditation compliance, safeguards patient safety and quality of care, and can impact reimbursement, reputation, and overall success of your surgery center. You want to uphold the trust with your patients, payers, and partners that access your surgery center. Your surgery center may participate in different types of surveys. Accreditation agencies including AAHC, ACHC, Quad A, and the Joint Commission. Regulatory surveys that are done on behalf of CMS or the Centers for Medicare and Medicaid Services. And you may also be in a state that has licensure requirements that receive surveys from your state Department of Health. The focus of this webinar will be on accreditation and regulatory surveys. However, these tactics and tools can serve you in any survey your surgery center participates in. Some surveys are announced or scheduled. You will know when the surveyors are coming. This is typically seen with an accreditation survey that does not incorporate a Medicare survey into the process. If you are using an accreditation body to survey you on behalf of Medicare, or the state is surveying your center on behalf of Medicare, these surveys will always be unannounced. A complaint investigation is also unannounced. If a complaint regarding your center is received by Medicare and it is determined that it needs to be investigated, surveyors will come to your facility without warning or unannounced. This can be one of the most stressful surveys that you participate in. When they arrive, they will share that they are investigating a complaint. They often do not share what the complaint is until the survey is concluded. At your exit interview, they will share whether the allegations had been validated or not during their survey process. Other types of surveys that your surgery center may experience include OSHA, CLIA, and hazardous waste. These surveys are very specific to the state and county that your surgery center is located in. You may or may not have these types of surveys at your facility. But if we shift back to the focus of regulatory and accreditation surveys, we're going to pretend that the surveyors have arrived at your facility. Often the survey team is made up of one life safety focused surveyor and two regulatory, clinical, and administrative focused surveyors. The surveyors are there to confirm that your center is compliant with the Medicare conditions for coverage, any regulations, and/or accreditation standards that they are surveying. It is very important that you have the standards that you will be surveyed against. If your survey is with an accreditation body, please double check that you have the correct version of standards that they will be using at the time of your survey. A surveyor's role is to verify that your center is following your center's policies and procedures. Are you doing what your policy says you should be doing? Surveyors will look at things like patient safety, infection control, and documentation. Surveyors will spend time reviewing staffing, training, and credentials. When surveyors are on site, it's important to understand how they get the information they need during the survey process. Surveyors will interview your staff and patients. They will observe your daily operations and review legal documents, medical records, logs, meeting minutes, and HR and credentialing files. Common pitfalls that surgery centers face during the survey process include a lack of documentation, inconsistent policies and procedures, non-compliance with life safety codes, ignoring minor deficiencies, and being reactive instead of proactive when there are issues that have been identified. The most frequently failed survey areas include emergency preparedness, credentialing and privileging, prevention and control, and quality improvement. If you have limited time to focus on preparedness, those are the key areas that you should focus on. How do you prepare your surgery center for surveys? This begins with pre-survey planning. You should have your team conduct regular internal audits on how you are doing with compliance. You should assign a survey readiness team. Empower all of your staff to get involved in the preparation of your survey. Ensure your staff are knowledgeable and confident in the policies that affect their daily work. And make sure you get everyone involved. This should not be a task that falls to 1 or 2 people at your facility. Everyone should be involved in the process. Mock surveys can be done internally or with a third-party consultant. At SMP, we work with surgery centers to perform mock surveys and survey prep. If you are looking to have a mock survey performed, we would love to connect with you, discuss your needs, and get a mock survey scheduled if deemed appropriate. Every department of your surgery center should be involved in the mock survey. Do not assume one department is doing everything appropriately. It is best to include all areas and verify actual compliance. You'll want to receive immediate feedback and create any action plans needed to address areas of non-compliance that were identified during the mock survey. Internally, you can do a gap analysis. Complete a self-assessment to identify any gaps in compliance and identify areas that need improvement. Once you have identified those gaps, you should categorize them by priority, high, medium, and low. You should categorize them based on the potential impact that they have on patient safety and care. Go through your conditions for coverage and/or accreditation standards. Create a spreadsheet, print this out, and make an evidence book. You should be able to write down next to each element how your surgery center is complying. Reference the document, policy, or log that you can prove this with. This will be very helpful during your survey. If a surveyor is asking for something and you are not sure what they are asking for, ask for clarification on the standard that they are referencing. You can then cross-reference your evidence book and find your proof of compliance. Staff training is an essential part of survey preparedness. Keep in mind that you not only need to be completing the training, but you need to be properly documenting your training. You should have regular in-services and education for any policy changes. You should have initial training that is completed within 30 days of hire, an ongoing review of safety, infection control, and documentation procedures. We're going to shift our focus to the key areas for compliance of surgery centers. Patient safety. Items that fall under patient safety include medication management. This is things like storage of your meds, labeling, proper handling of controlled substance, and proper disposal of medications. You also want to focus on your surgical safety protocols. Is your staff performing a proper timeout every time? Are staff properly following your surgery center's site marking policy? Governance and administration. You will want to ensure that your documents are current. This would include meeting minutes and credentialing files. Remember that your governing body is where the buck stops. Issues that the governing body deal with include the mission, goals, and objectives, long-range plans of the surgery center, and ensuring that there are adequate and appropriate facilities and personnel. The governing body is also legally responsible for the operation and performance of the organization. This includes your bylaws, policies and procedures, financial management, legal and ethical matters, and compliance with accreditation standards and CMS conditions for coverage. Keep in mind that the only place surveyors can verify the actions of your governing board is to review meeting minutes. It is very important that you remain diligent about how you maintain your minutes. Emergency preparedness. Every surgery center must have an emergency plan. This emergency plan must use an all hazards approach. An all hazards approach is a framework that focuses on capacities and capabilities. It should be specific to your location and take into consideration the particular types of hazards that are most likely to occur in your area. Things that should be considered include equipment and power failures, communication interruptions, including cyber attacks, interruptions in your normal supply of essentials, such as water. All hazards planning does not specifically address every possible threat, but ensures that the surgery center has the capacity to address a broad range of related emergencies. Things to remember to address include how your facility will protect vital records and any IT data. You will want to ensure the availability and functionality of emergency equipment that could be needed. Surgery centers should include a process for cooperation with local, state, and federal emergency preparedness officers. Responsibilities of your staff during an emergency should be defined. Staff members should be aware of what their responsibilities are. Your facility should have an easily accessible contact list for staff, contracted services, physicians, support staff like anesthesia, local emergency staff, and they need to have an alternative means for communicating. Infection prevention and control. Your teams should be performing audits on sterilization protocols, hand hygiene compliance, and monitoring of infection rates and tracking quality improvement. Remember, your facility must have a designated infection preventionist that receives ongoing infection control training. This training has not been defined as to what is required, simply that they must have education, and it should be ASC specific. Other items that you want to look at for compliance would include proper disinfection of medication vials and IV hubs prior to medication administration. You also want to ensure that all staff have proper personal protective equipment, or PPE, available for their roles. Physical environment, or environment of care. This is a great opportunity for you to do a walkthrough. Inspect your facility for things like safety hazards, cleanliness, proper equipment, or any security issues. Keep in mind that documentation is required of all maintenance, testing, and inspection activities under each standard and element. Examples of this are smoke detectors, fire alarms, and your automatic sprinkler systems. Staff training is an important part of ensuring that you remain in compliance. There are very specific requirements that you must meet with staff. New hires must complete new employee training. They must have documented training within 30 days of hire. Staff must receive ongoing training. This includes skills validation to ensure competency and that staff are following proper procedures. Performance evaluations should be completed on each employee. The evaluations should be completed consistently. Staff are required to have training on emergency preparedness. This includes participation in drills and simulations. Staff should be actively engaged in participating in those drills. They should be assigned roles and be able to demonstrate and articulate their responsibilities during different emergency situations. Emergency training should include a medical emergency, malignant hyperthermia, active assailant or security situation, weather, and fire. Your facility should also conduct regular training on survey readiness with your staff. This includes what to expect during the survey and how to respond to surveyor questions. Role-playing is a great opportunity for staff to practice responding to common surveyor questions and scenarios. A good example of this is a quality nurse or infection preventionist. Sometimes these roles are filled by staff nurses who may or may not have a lot of experience interacting with surveyors. Take time to role-play with these staff and walk through questions that surveyors will typically ask. It can be very eye-opening to hear how your staff answer. This gives you a great opportunity to coach your staff on how to best answer questions. If you're working with your infection preventionists, I recommend walking them through Medicare's Exhibit 351 Ambulatory Surgical Center Infection Control Surveyor Worksheet. If you are attending this webinar, you're most likely in a leadership role at a surgery center. It is your responsibility to set the tone for your facility. You should lead by example. Leadership should promote a culture of accountability and excellence in quality care. You should emphasize the importance of ongoing compliance. You should encourage and foster a culture of open communication about compliance. Staff should feel comfortable coming to leadership to point out areas of non-compliance so that they can be addressed. Encourage your staff to participate in survey readiness activities. When you recognize and reward staff for compliance and quality improvement, it encourages them to keep going and keeping it up. Ensure ongoing education and resources are available for your staff. You should provide training for staff on compliance and survey expectations. You should regularly review performance metrics and identify improvement opportunities with your staff. You should support your staff in taking ownership of their responsibilities during the survey process. Preparing for the day of surgery. You should assign roles and responsibilities before the surveyors come to your facility. This includes things like who will walk the surveyors through credentialing files, your personnel files, who has access to meeting minutes. Do your best to ensure that key personnel are available. It never fails that someone is always out of the office on a day that the surveyors arrive. It is important that someone else can speak to that person's roles and responsibilities. They may not be able to articulate everything with the same depth and ability that the particular team member can provide, but they should be comfortable enough to walk through the processes and locate documents and data that is needed. When you think that a survey is coming up, it is important to do some final preparation. Do a walkthrough. Make sure everything is in its place. Again, look for safety hazards and tidy things up. Review your key documents and records for accurateness and completeness. Spend some time with your staff. Communicate expectations to them and address any last-minute questions that your staff may have about the survey process. There are key documents that surveyors typically ask for, and these should always be readily available. It is recommended that you create a survey readiness binder. This can be done on paper or electronically. If you use a 3-ring binder, you can collate all of the information, or you can create an electronic folder with subfolders that contain all of the same information. Being prepared and leading with organization is a great way to get your survey off to the right path. Surveyors appreciate the organization and not waiting for documents. Your survey readiness binder should include your facility's organization chart, board meeting minutes from the past 12 months, your medical staff bylaws, a list of all of your medical staff, a list of all personnel with their titles, your quality plan and quality data since your last survey, your infection control plan and any surveillance data that you've had since your last survey. A list of all of the contracted services, your emergency plan, life safety documents, and records of your drills. This is not an all-inclusive list of items surveyors may request, but this is a great starting point and will keep you from feeling stressed hunting for documents that almost every surveyor will want to review. Up until this point, we've been talking about getting prepared for the survey to happen. Now we're going to shift our focus to the actual survey. Up until this point, we've talked about getting prepared for the survey to happen. Now we're going to shift our focus to the actual survey. On survey day, your survey team typically arrives as a group all at once. They will enter your facility, identify themselves, and ask to speak with leadership. They typically prefer a space where they can settle in and do their work. They will want to meet with your leadership and go through the surveyor's agenda and key areas of focus. Sometimes they prefer to do a brief tour of your facility, or sometimes they like to dive right in and start reviewing documents, which can include your charts, personnel and credentialing files, and meeting minutes. They will want to spend time interviewing your staff and do a tracer patient. This is where they will want to follow a patient all the way through a patient experience at your facility. They will watch registration, pre-op. They will follow a tracer patient. They will want to follow this patient all the way through a patient experience at your facility. They will want to watch the registration process, the pre-op process, spend time in your procedure room or operating room, watch the recovery and discharge. Things to remember on survey day are to stay calm. You should lead with confidence and transparency. If issues arise, be proactive in addressing them. It is important to remember that we take surveyors as they come. If you have been through the survey process, you probably recall a surveyor that has been grumpy or more difficult to work with, and a surveyor that has been more pleasant and collaborative. Unfortunately, we do not get to pick who walks through that door. It is important that you do your best to stay professional in every interaction. Get your leaders and team members involved and engage and participate in the survey. This is an ASC's opportunity to highlight all of the great work that has been done since its last survey. Make sure when your staff are communicating with surveyors that they are confident in speaking to their roles. Keep in mind that surveyors must conduct their survey according to what they read, what they see, and what they are told. They are fact finders and information gatherers. Remember to maintain a positive attitude and encourage your staff to remain calm, professional, and cooperative throughout the survey process. If you find your facility in a challenging survey that is not going the way that you would prefer, it is very important to maintain your composure. Avoid defensive or confrontational behavior. Demonstrate cooperation by showing a willingness to address concerns. If there are areas of non-compliance, acknowledge these areas without making excuses. An example of this could be, we recognize this area needs improvement and we are actively addressing it. Remember, it's okay to ask for clarification or ask what standard they are referencing. Do not guess an answer. Stick to the facts and provide direct answers that are supported by documentation. If a surveyor's interactions seem incorrect or their interpretations of something seem incorrect, respectfully provide context or additional details. Keep detailed notes of your surveyor's concerns and suggestions throughout the process. If your surveyors are willing to educate and offer suggestions, listen. Often they're just consultative suggestions, but sometimes they can help you find a simpler way to meet the standard. If you maintain transparency, professionalism, and a solutions-oriented mindset, you can help navigate a difficult survey with integrity and set a positive path for improvement. When surveyors make requests for information, get the information as quickly as possible. This is where your evidence book comes in handy. You want to be organized and quickly be able to turn over information that is requested. Surveyors can get irritated quickly when they are waiting for information they have requested. This can be avoided by preparing and organizing ahead of time. Also, make sure that you are getting them the opportunity to speak with personnel that they need, whether this is the infection preventionist, the quality nurse, etc. At this point, you have survived your survey. The surveyors have concluded their time and they are ready to have your exit conference. Pay close attention to any feedback provided by the surveyors during that exit conference. Develop an action plan to address any deficiencies noted by the surveyors. Once your survey is complete, you will receive a report. If non-compliant areas were found, you will be required to submit a plan of correction. A plan of correction will address how your facility will address the non-compliance and become compliant. A big part of the plan of correction is follow through and ensuring ongoing compliance going forward. You may have something that is easily correctable and can be quickly remedied. Fixing alone is not enough. You must put processes in place to ensure that your surgery center will stay in compliance going forward. Expired medications or supplies is a good example. If we take an expired drug that is found during the survey on your crash cart, it's not enough to just replace that expired drug with a non-expired drug. You have to put processes in place to catch drugs that are expiring, and so this is prevented from happening again. This is often done by implementing a monthly check where staff review all expiration dates. Use the survey findings as an opportunity for continuous improvement, and this will help you prepare for your next survey cycle. Keep in mind that you want to maintain this momentum after the survey. It is easy to be excited that the survey process is over, but you want to make sure that you are being diligent on maintaining all of your efforts so that you maintain that survey readiness. Preparing requires significant time and effort, but the benefits and long-term payoff make it worth the investment. It is very important to focus on preparation, teamwork, and continuous improvement. Compliance with regulations and accreditation enhances your organization's reputation and assures that patients and stakeholders of the exceptional care that they can expect at your facility. Again, don't forget to get everyone involved. Talk about survey readiness at all meetings. Talk about it with your board, your physicians, your staff, and your contracted vendors. Make survey preparedness an important part of the culture of your facility. Thank you for your time today. We at Surgical Management Professionals provide a customizable approach to working with surgery centers. If you have an interest in a mock survey or other surveys that SMP offers, please reach out to us at info@smpsd.com. Thank you.